Hello, my name is Elizabeth. Oh, hello, I'm so sorry. This is Elizabeth Walker-Romero. I'm the Senior Director of Health Improvement at the Association of State and Territorial Health Officials. Welcome to today's interactive webinar, Regulating E-Cigarettes in the European Union. In February 2014, the European Parliament approved a new set of rules regulating electronic cigarettes. These new rules, slated to take effect in 2016, would ban the advertising of e-cigarettes, limit the nicotine concentration in e-cigarettes, require e-cigarettes to be childproof, and mandate health warning labels on e-cigarettes. Currently in the United States, the FDA has not issued regulations for e-cigarettes. In the absence of federal regulations, states are taking a variety of approaches to regulating e-cigarettes at the state level. In this webinar, we are delighted to have experts for the European Commission, Action on Smoking and Health, and the European Parliament. We will introduce each of our speakers before they present on the call today. All phone lines for the participants have been muted during this webinar. And if you have questions for any of our speakers, please post it to the chat box on your screen anytime to the webinar. You should see it on the left-hand side. These questions will be used during the Q&A session after today's presentation. At the conclusion of the webinar, you'll be directed to an evaluation survey. Please take a few minutes to provide us with feedback, and we look forward to hearing from your comments. Also, a recording of this webinar and corresponding slides will be posted to the ASTHO website in the next few days. And I'd like to take a special moment to thank Ms. Linda McAvan for answering a 1 o'clock in the morning email from a New York Times article that really talked about all this amazing work that you have been leading with all of your partners in Europe. And so we're very excited to have you here today. It is my pleasure to introduce Dr. Ed Ehlinger. Minnesota Governor Mark Dayton appointed Dr. Ed Ehlinger to serve as Minnesota Commissioner of Health in January 2011. Dr. Ehlinger is responsible for directing the work of the Minnesota Department of Health and is the state's lead public health agency responsible for protecting, maintaining, and improving the health of all Minnesotans. We'd like to really just thank Dr. Ehlinger because he also serves as the chair of the ASTHO Tobacco Issues Forum, and we'll introduce each of the speakers, and he and I will be facilitating the Q&A portion of the webinar later. So Dr. Ehlinger, I pass it on to you.
Thank you, Elizabeth, and welcome to everybody. I'm really excited to be part of today's webinar and look forward to hearing from the speakers that we have on this really important public health topic. It's certainly current here in Minnesota, and I suspect throughout the world on an issue that is gaining importance. So we're joined today by an esteemed panel of experts who will be telling you individually more about their specific role in tobacco control. Before each speaker, we will be providing a brief introduction, and we anticipate that there will be many questions for our speakers, so we've made an effort to allot time at the conclusion of the panel presentation for those questions. We are first joined today by Dominik Schnichels, the head of the Unit of Substance and Human Origin and Tobacco Control for the European Commission. Dominik Schnichels is head of the unit in DG SANCO, the Consumer and Health Department of the European Commission. His team prepared the revision of the EU Tobacco Products Directive and was responsible for the negotiations in Council and Parliament. Dominik is a German lawyer by training, and after his studies in Germany and the UK and a PhD in European law at Munich University, he started his professional career in an international law firm. In 1995, he joined the Trade Department of the European Commission, where he worked in the anti-dumping services. In 1999, he changed to DG Competition, where he was responsible for many high-profile investigations into the European energy and healthcare sectors. In 2011, he changed to his current function in DG SANCO. We are thrilled to have Dominik with us today, so I will turn it over to you, Dominik. Thank you, Dr. Schnichels. Those comments are quite pertinent for us, and I'm sure there are going to be lots of questions. We will take those at the end of the presentation, so use the little chat box for all of the people listening to this today to put your questions. So thank you again for sharing your perspective and overview of the issues of e-cigarettes in the EU. Now we'll move to our next speaker, Deborah Arnaud, the Chief Executive at Action on Smoking and Health, or ASH. Ms. Arnaud is recognized as an international expert on tobacco control and the WHO Framework Convention on Tobacco Control, with a particular interest in nicotine regulation and harm reduction. She was a member of the National Institute for Health and Care Excellence, or NICE, Program Development Group, which developed the guidance on tobacco harm reduction of the Commission on Human Medicines, Expert Advisory Group to the Medicines and Healthcare Products Regulatory Agency, MHRA, on nicotine-containing products. NICE is a non-departmental public body for England, which provides national guidance and advice to improve health and social care. The MHRA is responsible for regulating all medicines and medical devices in the United Kingdom. She also has experience of product regulation under the EU General Product Safety Directive, having participated in the development of fire safety requirements for cigarettes. And Ms. Arnault has an MBA from Cranfield, is an honorary associate professor at the University of Nottingham, and is an honorary fellow of the Royal College of Physicians and a member of the RCP's Tobacco Advisory Group. She was awarded the Alwyn Smith Prize in 2007 by the Faculty of Public Health for her outstanding contribution to public health. So please remember, for everybody listening, that if you have questions for one of our speakers, post it in the chat box on your screen at any time during the webinar. So, Ms. Arnault, I turn it over to you.
Thank you. And I'd like to start by just placing my thanks to the European Commission and also to Linda McCavan, who led the negotiations for the European Parliament on the Tobacco Products Directive. It was extremely difficult, particularly getting an agreed position on electronic cigarettes. When you're negotiating amongst 28 member states and their parliamentarians who all have very different positions, I think they did an excellent job, but I'm sure they would recognize that the position that the EU has ended up with is very much a compromise position. I'm going to talk much more about the specific situation in the UK, which has really been taking a lead in this area even before the advent of electronic cigarettes. I'll just start by talking a bit about ASH very briefly. We were set up by the Royal College of Physicians to reduce the harm caused by smoking. We get our core funding from cancer and heart charities. We don't get commercial funding. We have no funding from the pharmaceutical industry, the electronics industry, or any other industry. We also get project funding from our Ministry of Health to support implementation of government strategy. And we work at policy on UK, EU level, and actually global level within the WHO FCTC process. The UK is a story of success. For some time now we've been in the lead in Europe, and that's through a comprehensive strategy which was first implemented to reduce smoking prevalence in 1998. But still, smoking remains the major cause of preventable premature death and also a major cause of disability within the UK. And over 80,000 people are killed each year through smoking-related disease, more than all the next 6 causes put together, including obesity, alcohol, illegal drugs, etc., etc. Smoking also remains the greatest cause of health inequalities beginning in childhood, and you can see that smoking rates are far higher in what we call routine and manual workers than they are in managerial and professional. And that's a pattern we see in the US as well, although you tend to measure it through educational level rather than socioeconomic status. It's also the case that people with mental health problems have far higher rates of smoking, and this is a major cause. In fact, if you have serious mental health problems, you're more likely to die from smoking than from your mental health problems. So within the UK, that's a major driver of policy implementation. Our smoking cessation policy is in advance of the rest of Europe and many places in the world, in that we have all smokers have access to smoking cessation services free at the point of delivery, including counselling and medicines on prescription, which means that you may have to pay for them but at a reduced rate, and many people, particularly the poorest in society, won't have to pay for their medication. But the uptake is relatively low. The products aren't particularly attractive, and the most disadvantaged, as I said, continue to have high smoking rates. So working with the Royal College of Physicians and our coalition, which is over 250 members now, we work to develop a harm reduction strategy, looking at how, if you can't stop people smoking, you can at least stop them killing themselves from their nicotine addiction. And our position was published in 2008, the year after a very seminal Royal College of Physicians report was endorsed by 100 organisations at that time. The support for the coalition has grown since then. And the sort of positions of principle were that nicotine products must be attractive as direct replacements for cigarettes, that consumers need to understand the benefits of using pure nicotine products as an alternative to smoking, that products should be widely available and visible on the high street, that price should provide an incentive to switch from tobacco, and that regulation should be proportionate to risk. Now, this was all before, well, I think e-cigarettes may have been launched on the UK market, but certainly before they took off. And it was really sort of outside any kind of thought about what might happen with electronic cigarettes that this strategy was developed. And the current government policy which developed out of that in relation to e-cigarettes is that currently e-cigarettes are regulated as consumer products, and that will stay the same, but that and that we still support. I mean, we're not trying to say that harm reduction is a better alternative to quitting. Certainly stopping smoking immediately is the best option. But for those unwilling or unable to stop using nicotine, harm reduction approaches are appropriate using licensed nicotine products. And the medicines regulator has licensed medicinal nicotine, NRT, for long-term use, to cut down, and for temporary abstinence. And NICE has developed guidance for healthcare professionals supporting such a harm reduction approach. As elsewhere in the world, the use amongst British smokers of e-cigarettes has grown rapidly. When we first started measuring it in 2010, it was about 3% of smokers currently using e-cigarettes, and that's grown to about 18% in 2014. The numbers ever trying e-cigarettes was 9% in 2010 and has risen to over 50%. And the pattern remains the same, which is for every 3 smokers who try, and this is a cross-sectional study, it's not a longitudinal study, and obviously there are limitations with that, but basically for every 3 smokers who try e-cigarettes, only 1 carries on using them. So current use in the UK, under the context of current consumer regulation, is that it's growing rapidly, and we estimated on the basis of that survey that it was around 700,000 in 2012, and it's now around, well, over 2 million. And that in 2014, of those 2.1 million, 1.5 million were current smokers, and 600,000 were ex-smokers, but still using e-cigarettes. Now, health professionals here, as in the US, have concerns about the renormalization of smoking, but so far our research and the research by others in the UK shows little use by non-smokers, either adults or young people. And adult and youth smoking is still going down, and I'll go into more detail about that now. So if you look at this, you can see that in 2014, use of e-cigarettes amongst those who have never smoked is non-existent, basically, below 1%. Use amongst those who smoke every day is much more significant, and that's where you've got the sort of 19% of current use. And there is use amongst those who smoke, but not every day, and some use amongst those who used to smoke. But as I say, no significant use amongst ex-smokers. And this is a large sample we're talking about. Well, I don't have the figures in front of me here, but they're on the links that I've provided at the end of the presentation. And it's not just amongst adults. Certainly we find, and this is a much smaller sample, and again it's cross-sectional and it has limitations, but basically amongst young people, and this was a survey of 11 to 18-year-olds, there's no use amongst, or almost non-existent use amongst never smokers, and consistent regular use as opposed to experimentation. I mean, teenagers and young people experiment, we know that. The issue is, are they regularly using e-cigarettes? And the answer is, it's only those who are already smokers who are using these products regularly. This is figures from 2013. We've just finished carrying out the 2014 study and haven't done the proper analysis yet, but it's looking like, although the overall numbers have gone up, the pattern is the same. So there you can see that it's also the case that regular weekly use is confined to older children, so it's amongst the 16 to 18-year-olds as opposed to the 11 to 15-year-olds. and combining this with work carried out by Professor Robert West, who some of you will know, who's a renowned researcher into smoking in the UK. His work, and he has a regular survey of smokers called the Smoking Toolkit Study, and more detail about the methodology of that is contained in the links at the end of this. But what he's been able to show, which is quite interesting, is that use of e-cigarettes for quitting has gone up considerably and has been accompanied by a smaller reduction in the use of other aids except for behavioural support. And this is a survey, you can see it covers medicinal nicotine over the counter, medicinal nicotine RXs on prescription, Champics, and behavioural support. And at the same time, and obviously this does not prove a causal link, but I think it is interesting to see that at the same time as use of e-cigarettes has gone up, quitting has gone up as well. And so the percentage of ex-smokers, people who have smoked in the past year who do not smoke now, has gone up. While these are long-term studies and they don't go up to the present day, but e-cigarette sales really started to take off in 2009. And as you can see, the rate, if you were going to see undermining of denormalization and a gateway effect into smoking, you would expect to see that adult and youth smoking would not continue to go down, when actually both have been going down. And if you look at this, you can see that regular smokers in England aged 15 have fallen considerably over the last decade and more, and the trend continues downwards up until 2012 with no sign of it switching back up again. And then if you look at Robert West's data, which is published more regularly and goes up to the first quarter of 2014, actually, again, the trend continues to go down since 2011, and we're now seeing adult smoking prevalence in England of below 18% for the first time in living memory. So, nicotine regulation in future. In the UK, there is a twin track approach. E-cigarettes are currently regulated as consumer products. I see the Tobacco Products Directive regulation being as regulating them as tobacco products. But there will also be an alternative. They can opt into medicines regulation. Dominik talked about the fact that governments can decide to regulate them as medicines, but actually this has been challenged in the European courts. And governments have lost on this in the same way as they did in the US. Our medicines regulator, while it continues to encourage companies to voluntarily submit to medicines license applications for electronic cigarettes, is not saying that it will require medicines regulation. Although we do currently have two products which have publicly been stated to be going through the licensing process, and other manufacturers, importers, have said they will do so, including some of the big manufacturers like Enjoy. Our government has also announced that there will be an age of sale for e-cigarettes of 18, and this is expected to come into force in April 2015. And our advertising rules are being updated in the light of rapid growth in the market in advance of the TPD regulation coming in. As Dominik said, under the European legislation on the Tobacco Directive and additional legislation brought in the UK, tobacco advertising, promotion and sponsorship is completely prohibited, including point of sale, and in fact we will have a complete ban on displays of tobacco products in shops from spring 2015. Brand sharing is completely prohibited throughout the EU. E-cigarette advertising is regulated in this light. We've got a consultation going on at the moment on the advertising code. And I think it's really important that e-cigarette advertising should evolve in the light of the emerging evidence. So if we look at the twin track approach, and the medicines regulator in the UK is more forward thinking on this than it is in some other European countries, and medicines regulation is variable. For example, the UK, a number of years ago now, I think it was nearly 10 years ago now, decided that all medicinal nicotine products, NRT products, should be taxed at only 5% when the standard rate of VAT, of sales tax, in the UK is 20%, to provide an incentive to reduce the price and provide an incentive to people to buy these products. Under the TPD, cross-border advertising will be banned. Under the medicines regulation, advertising is allowed to adults. It has to be targeted to adults. You can't make health claims under the TPD. You can make health claims, obviously, under the medicines regulation. There will be limits on strength, as Dominic pointed out, of 20 milligrams per mil, whereas under medicines regulation there will be much more flexibility on what can and can't be regulated, and the medicines regulator has encouraged manufacturers and importers to come forward with all sorts of varieties of devices. On products regulated under the TPD, there will have to be a 30% health warning on the packs, warning about the harm caused by nicotine. That will not be required on medicines. Member States retain powers, for example, banning flavours. Under medicines regulation, flavours will certainly be allowed. Under the TPD, you can't have these products on prescription. In the UK, the products will be available on prescription, as will all other NRT products, and will be free to poorer smokers. Under the TPD, products will be widely available in the UK, and this is different in some other member states, and that's one of the reasons why there were arguments in favour of regulation under the TPD and not medicines, which was the original proposal by the Commission. But in the UK, products that are licensed as medicines are available not just in pharmacies, but also widely available elsewhere. So in conclusion, electronic cigarettes are still new and evolving. They may be electronic, but they're certainly not cigarettes, nor are they smoked. But the fact that they're called cigarettes and described as being smoked, I think has led to alarm that is completely out of scale with the potential risks. So far in Britain, the evidence is that they're helping smokers quit while not undermining denormalisation. My view is that regulation needs to evolve in the light of the evidence, to be flexible, to ensure safety and quality of the product, and require market surveillance and monitoring. But there is a very real risk, so there are risks in both directions. Okay, there are risks about gateway, and we need to keep monitoring it, because just because it doesn't appear to be a gateway yet doesn't mean that that couldn't happen in future. But on the other hand, over-regulation could actually undermine quitting, and that would be a very sad thing if it happened. Britain will be going down a dual route from 2016, so manufacturers will be able to opt into the TPD or into medicines regulation. And I think the lesson for the US is that you need to ensure that electronic cigarette regulation maximizes the benefits while minimizing the risks. And you have to do that within the context of your regulatory environment, which is obviously different from ours. And we're going to be very interested to see what the FDA deeming regulations look like when they come out. And if you have any idea when that will be, I'd be very interested. And here are all the links to the information that was included in my presentation, including particularly, I would point to the MHRA information on licensing of nicotine products, because the MHRA did a lot of research into electronic cigarettes and the potential risks and benefits.
All right, Ms. Arnault, thank you very much for your comments. It stimulated, at least in my mind, a lot of questions, so I suspect in others too. So we appreciate you sharing the work of the coalitions and the work that you're doing at the local and national level towards these issues. I'd like to now introduce our next speaker, Linda McAvan. She was first elected as a member of the European Parliament in 1998. She was re-elected in 1999, 2004, and 2009 as head of Labour's regional list for Yorkshire and the Humber, a region in the north of England. She is the European Parliament Social and Democrat Group spokesperson on the Environment, Public Health and Food Safety Committee. Linda has a special interest in a number of health issues. She was recently the Parliament Rapporteur on the 2014 Tobacco Products Directive, leading negotiations on the new law between the MEPs and the national government. Previously, she has authored EU legislation on pharmacovigilance. She has also worked closely on climate change law, including the latest reform of the EU emissions trading scheme. So, turn it over to you, Ms. McAvan.
Yes, good morning to people in the United States and good afternoon to those over in Europe. I can see now the usefulness of slides for these presentations, and I'm sorry I haven't prepared any slides. So maybe I'll try and be brief, because you've had a lot of information, technical information, about what the new EU law will do. And maybe if I could just put some context and explain what my role has been. I'm an elected politician, so in the EU lawmaking system, the European Commission, you heard from Dominik Schnichels earlier, in our system, the European Commission puts a draft law on the table. So the Commission drafted the law. And in the case of e-cigarettes, just to be clear, since you had a lot of information, the original draft law from the European Commission said that e-cigarettes should require a medicines license. And that's what the proposal was, essentially. There were some details in it, but essentially most e-cigarettes would have to have a medicines license. That was the original proposal from the European Commission. But before a European law can become a law, it has to be agreed by members of the European Parliament, who are elected from the 28 different countries which make up the European Union. But it also has to get the agreement from the 28 governments of the European Union as well. And so the outcome on e-cigarettes is the result of negotiations between those two sets of legislators, national ministers, health ministers in this case, and the members of the European Parliament. So it was not an easy discussion. There were different views between politicians from different countries. But also there were different views between members of the European Parliament and the government ministries from the 28 different countries. And this might be something, I'm not an expert on US lawmaking, but I suppose in your state legislatures, you also have to get agreement from politicians on procedures and on regulation of e-cigarettes. And so maybe some of what happened in Europe may also be of value to you as well. The other clarification I'd like to make, I see some of the questions which are popping up, is people saying, why doesn't the European law address age limits? Why doesn't it address issues of bans in public places? Well, just like in the United States, where you have the federal government has responsibility for certain things, and your state legislatures have responsibility for other things, we have the same divisions in the European Union. Some things are done as a European Union law, which will apply to all 28 countries, but other things are left to individual countries to resolve themselves. And so the issues around whether or not e-cigarettes should be used in public places will be a matter for each individual government. In the United Kingdom, I'm a British politician, member of the Labour Party. In the United Kingdom last week, one of our, the Welsh government, we have within the United Kingdom a Scottish government and a Welsh government and the Northern Irish Assembly, who have devolved powers on public health issues. The Welsh government announced it's looking at not allowing use of e-cigarettes in public places. But that doesn't bind England or Scotland or Wales or Northern Ireland. And that's a matter for national discussion. It will not be resolved at European level. And so that's just to clarify why certain things have been in the European directive and not in others. So I said that when we started the procedure, the legislative process, we began with proposal that e-cigarettes should be medicines, the 28 governments from Europe, by a vast majority, I think 26 out of 28 governments, said that they also supported the idea that e-cigarettes should have to have a medicines license. Amongst the MEPs, positions were more divided. And MEPs, when we had the vote in the procedure, came out in favour of having that e-cigarettes should be treated like other tobacco products. In other words, they should be allowed on the market, but would not need to be pre-authorised on the market. And so when we open the discussions between the governments of Europe and the MEPs, that's where we started from. Governments wanting medicines regulation, and the members of the European Parliament wanting a lighter touch regulatory regime. And in the end, you've seen that what we've ended up with is a kind of hybrid, where most e-cigarettes, I believe, will be on the market regulated as tobacco products. But individual companies will choose, as Deborah Arnott has just described, they may choose to apply for a medicines license because it could bring certain advantages. Like in the United Kingdom, it means that they could be available on prescription, or they could be subject to a lower VAT rate, or they may want to advertise their products, because the ones which have a medicines license will be able to advertise their products as quick products subject to regulatory procedures, whereas the other e-cigarettes, which are leisure products essentially, will not be able to market their products through general advertising. And so we've ended up with a regulatory system which allows the e-cigarettes to be on the market, but with this dual regulatory regime. In terms of the lobbying we had, which also might be of interest to you, we had the companies, e-cigarette companies, have been divided on what kinds of regulatory framework they want. Some have applied for medicines licenses and want that. Others lobbied very hard that if they had to get a medicines license, that was tantamount to a ban. And it became widely believed by many people, including members of the public, that the European Union was going to ban e-cigarettes and take them off the market. That wasn't the case, and that's not what's happened. But there was a very strong lobby by some companies to not have an EU system of regulation. We had lobbying from individual users, vapers, as the groups call themselves, of e-cigarettes, lobbying about how they saw the issues. And then we were lobbied also by the medical community, doctors. And their doctors are divided, to be honest. Some doctors see e-cigarettes as potential to help smokers quit, and other doctors express concerns that e-cigarettes would lead to dual use of tobacco products. And there, I think, the real truth is we have some evidence, and Deborah Arnott presented some evidence, that we need some long-term studies. And I think I did have discussions with the FDA in the United States, and the FDA told me they are doing a long-term study on e-cigarettes and looking at the evidence. And I think we will see longer-term studies coming out of different European countries. So I think that's more or less everything I have to say to you. I'm happy some of you can pose questions and comments. You have the technical information, exactly what the new law will mean. Maybe I should also clarify that under EU lawmaking, what the European Union agrees is a framework law. The framework law then has to be implemented in each individual country, and the countries have until 2016 to get that law in place. Again, I'm not sure how your federal system works when you have a federal law, how it's implemented in different countries, but it does mean that different countries might start implementing the law on different dates. It also means that some countries might add to the law, like the UK has already indicated it will add an age ban to the existing European. So the European law is a minimum, and the individual governments in some areas can go further in terms of public health measures. So we shall see, as Dominik Schnichels explained at the start, the e-cigarettes is only one article which is part of a much bigger piece of legislation on tobacco control. If I make maybe a reflection, a final reflection, when we started the process, it wasn't seen by the European Commission or the governments of Europe as the biggest issue, because the issues of which are controversial about size of warnings on cigarettes, banning flavours on cigarettes, things I know if you're involved in tobacco control in the States, you will be familiar with the arguments because the FDA has been involved in these discussions. These were seen as the bigger issues, and the e-cigarette was a smaller issue. But that became, in the end, a controversial issue, and it did take a lot of discussion between the governments. As I said, had a different position. The health ministries of most of our countries wanted very, very tough regulation, and the MEPs who felt we should have a more flexible regime and allow the products on the market to see whether they can contribute towards helping people reduce their smoking. So maybe I'll leave it there. And like I said, if people do have any more questions, I'm happy to take it.
Well, Ms. Backman, thank you very much. Interesting presentation. Before moving into our question and answer session, I'm going to take a moment and share some of the resources that are available from ASTHO, the Association of State and Territorial Health Officials, some of the resources that support our state and local health departments in doing the tobacco control work, especially as regard to the e-cigarettes, which are becoming increasingly important. This last January, ASTHO, along with the National Association of City and County Health Officials, or NACHO, co-hosted a webinar describing the policy efforts on a local and state level addressing e-cigarettes. We had presenters from across the country, Minnesota, Chicago, Seattle, King County, and reviewed examples of policies specifically addressing e-cigarettes and described resources that are available to help state and local health efforts. The slides and the recordings of that webinar are located on ASTHO's tobacco control website. And on this website is also a letter from last October that ASTHO sent to the U.S. Food and Drug Administration Commissioner Peggy Hamburger, urging the regulation of electronic cigarettes. As a result of the interest in the topic of e-cigs, ASTHO convenes states who are exploring options to address e-cigarettes in a new work group. And this work group was formed to help advance state tobacco control efforts in this new and fast-evolving area, and provides an opportunity to exchange information with colleagues engaging in similar work. We now have 23 states and 11 national and or federal agencies are part of that work group, and my guess is that many of those work group members are on this webinar. This group meets virtually about every 6 weeks to discuss topics related to e-cigs. ASTHO will be releasing an issue brief on e-cigarettes in the next few weeks that will help highlight the work of the various states through a number of case studies, and these documents will also be posted on the ASTHO website. In addition to this, ASTHO also convenes the Tobacco Issues Forum, of which I am the chair, a work group that, under the guidance of our Prevention and Policy Committee, is comprised of members and staff from key affiliate and partner organizations. The group serves as an opportunity to share tobacco control activities, resources, and identify opportunities to speak in a collective voice and examine the overall picture of tobacco prevention and control in the states. The web address for ASTHO's tobacco website, where you can access more information about all of these resources, is up on the screen now, and also on the last slide of the presentation, along with the contact information of the ASTHO team. So that's sort of what ASTHO is doing. And so now we have about 25 minutes or so for questions, and I hope you've been putting questions in the chat box. But I want to start out by just posing a question to our three presenters, which I think really presented some really interesting information. But certainly here in Minnesota, where we have a bill before our legislature right now about dealing with e-cigarettes, the policymakers are looking at three things. Are e-cigarettes a gateway drug? Can they be used for cessation? But they're also looking at secondhand vapors. A lot of our tobacco control, our Clean Indoor Air Act, was about protecting others. And have those environmental issues been part of your discussions in terms of policies in the European Union on e-cigs? All right. Well, Dominic and Deborah and Linda, thank you very, very much. So you presented a lot of really useful information for us here in the state. And let me turn it back to Elizabeth Walker-Romero for closing up.
No, we just want to, I think, as you said it all, we really thank you all for joining us today. I think you've given us a lot of different perspectives to consider in the work that we have going forward here in the United States. And hopefully this is not the last time that we will be interacting, and that as you all learn different things that you'd be willing to share. I believe you have our email addresses. And then for those on the call, if there's any additional questions, you more than happy to please email us at ASTHO. We are happy to share information or questions back on again. So as of today, the edited recording of today's webinar will be available on our website within the next few days. And you hope you use this webinar as a resource and share the link with others once it's available. Again, our contact information is provided you on the last slide, and we really just hope everyone has a nice day. And thank you to all of those overseas who are willing to come on later in the day. So thank you, and thank you, Dr. Ehlinger, and thank you, Diana, for putting all of these pieces together.